On behalf of the Health Initiatives team, I want to welcome you to the Health Partnership Program and briefly go over the terms of the agreement. Our desire is that you have the same levels of success that thousands of participants have experienced in the past. They have reversed type 2 diabetes, pre-diabetes and heart disease, lost weight, shrunk their waistlines, and brought down their blood pressure, cholesterol, triglycerides, and blood sugar. It is interesting to note that over the long term, graduates of the Health Partnership Program have lower annual medical bills than the general membership, even though they come in as high risk. At any given time, of the 16,000 Christian care households across the nation, nearly 1,000 of those households have at least one family member participating in the Health Partnership Program. Before we look at the agreement, allow me to tell you how the coaching program came about. In 1993, Dr. John Reinhold founded the Christian Care Ministry Medical Bill Sharing Program. Over a period of a few years, he realized that there were groups of people who never submitted any medical bills. When he investigated, he discovered they were living a healthy lifestyle that included regular exercise, healthy eating, and a strong, active faith. Out of this discovery, Dr. Reinhold formed the Wellness Department, now known as the Health Initiatives Department, enabling members to work toward their health goals with the assistance of a health coach. Let's look at the specifics of the Health Partnership Agreement. In order to continue in MediShare and to graduate from the Health Partnership Program, I agree to the following. Number 1, work cooperatively with my health coach. This means I will participate in the program in good faith, that is, by really making an honest effort to succeed, showing up for appointments. I will keep an open mind and heart to examine the biblical principles that are the foundation of the program and the evidence that is presented from the scientific research. Number 2, maintain a regular exercise and nutrition program consistent with my goals. At a bare minimum, meet the exercise requirements set forth by the American College of Sports Medicine, American Heart Association, and American Cancer Society. That is 30 minutes 5 days per week of aerobic exercise, 2 to 3 strength training sessions for the major muscle groups, and daily stretching. At a bare minimum, meet the nutritional requirements set forth by the leading health organizations such as the Harvard School of Public Health, the Mayo Clinic, Florida Hospital, and the Cooper Institute. Consume a diet rich in vegetables, fruit and berries, whole grains, beans, nuts, and seeds. If you are at high risk for heart disease, stroke, cancer, and diabetes, moderate changes in your diet and exercise will not take you to your goal. There is a saying, you cannot ward off a herd of charging elephants with a handful of marshmallows. You cannot reverse years of abuse to your body by making only small, comfortable, short-term changes. Number 3, as stated in point number 1, I will consistently adhere to my appointment schedule and promptly reschedule any missed appointments. You may have taken note of a specific schedule of appointments for the program, but your schedule will depend on your goals and your needs. Number 4, I will complete my assignments. Assignments will include some foundational information relevant to everyone, but beyond that, the assignments will be tailored to your goals and any barriers you are encountering. There is a wealth of resources on the website, mychristiancare.org, a health risk assessment which everyone is to take, plus printed materials and audio and video resources. Number 5, I will self-report. That is, write down and report measurements related to my goals. I may also be required to submit lab results for cholesterol and blood sugar every 3 to 6 months if I am at high risk or if these numbers are not known. Number 6, I will reach the required outcome goals within 12 months. The average number of months to graduation is 5 months, and some graduate in as little as 2 months. If you are a regular health partner, that is no diagnosed disease, the requirements are body mass index less than 32. Body mass index is based on your weight in relation to your height. For example, a person who is 5'10" and weighs 222 pounds has a BMI just below 32. A person who is 5'4" and weighs 186 pounds has a BMI just below 32. Waist measurement below 41 for a man, below 38 for a woman, systolic blood pressure below 135, diastolic below 90, total cholesterol less than 220, LDL cholesterol less than 150, HDL cholesterol greater than 35 for men, greater than 40 for women, triglycerides below 200, HbA1c between 4.2 and 5.9. HbA1c is a single non-fasting blood test that is a measure of your average blood sugars over a 2 to 3 month period. If you come into the program with a diagnosed disease, graduation requirements are more stringent. You've no doubt recognized that these are not healthy levels. They are merely what will allow you to graduate. In general, if health partners continue with the lifestyle that enabled them to graduate, they will achieve truly healthy goals in the months that follow. Please keep in mind that your health coach is an educator and co-strategist and does not diagnose, treat, or prescribe for disease, illness, or injury. In addition, keep your exercise program within the bounds prescribed by your physician. Progress slowly and follow safe guidelines for each form of exercise. Consult with your physician or call 911 for any symptoms associated with your exercise. For example, lightheadedness, dizziness, difficulty breathing, nausea accompanied by unusual sweating, crushing chest pain or pain radiating to the back, shoulder, neck, or arm, sudden weakness, especially weakness on one side of the body, sudden loss of vision, or difficulty speaking. Are you at high risk for major disease, or have you already been diagnosed with a major disease? Lifestyle change can make a difference. Don't be discouraged. God has built into our bodies a tremendous recovery potential. We believe that you hold a key because health is much more a function of our choices than it is of genetics, gender, or age. May God bless you richly, and may you have the same level of success that so many others have experienced. We are here to serve and are grateful for this opportunity.